All right, so let's take you now to Geneva in Switzerland, where the World Health Organization is giving an update on the coronavirus pandemic. We take you live there now.
Making the zoonotic leap from animals to humans. The Preparedness Board was set up 2 years ago by the WHO and the World Bank to break the cycle of panic and neglect, which have seen through multiple disease outbreaks. There has been a recurring pattern of money being thrown at outbreaks when they're already in full flow, but then funds no longer being available to prevent the next outbreak. Reviews and reports are only as good as the recommendations that are implemented. COVID-19 has shown that collectively the world was woefully underprepared. But with humility and togetherness, we can plan for the long term and invest in health and preparedness. This isn't charity. It's an investment in our collective future. In this new report, the GPMB lays out the key lessons the world must learn from the pandemic and the concrete actions we can take to protect ourselves. Let's ensure the recommendations are taken seriously, and together our early warning and surveillance systems are improved so that we quickly and effectively curb outbreaks. This pandemic has shown that whether countries are rich or poor, health systems can be completely overwhelmed and essential services can break down. As I said, many of those countries that responded well have learned from previous outbreaks. On 13 January this year, Thailand was the first country outside of China to record a case of the disease. Thailand's experience with SARS and H5N1 combined with a strong public health and surveillance system gave them the muscle memory to respond quickly to COVID-19. Leadership across government of Thailand and public engagement, supported by 1 million community health workers, helped swiftly scale up an effective track and trace system. This empowered the country to suppress the virus as citizens played their part in breaking the chains of transmission. WHO recently shared a video outlining Thailand's response, and we appreciate Thailand. Developing muscle memory like Thailand did from previous outbreaks is key to pandemic response, and now we need the whole world to strengthen preparedness. From endless warnings about the world being underprepared, all countries need to dig in together and invest to ensure a pandemic of this magnitude and severity never happens again. With the right political and financial commitment and investment now, we can prevent and mitigate future pandemics. In a world that's heating up and where intensified human activity is shrinking wild spaces, the likelihood of spillover of a novel pathogen from animals to humans is increasing. We know for certain that there will be future novel viruses and another so-called disease X. But we also have the tools and know-how that the only way confront these global threats is as a global community, united in solidarity and committed to long-term cooperation. As some countries start to open up, we see cases and deaths starting to spike and concerns about potential lack of hospital capacity. This is a critical moment for countries, and we ask leaders to put targeted measures in place that we know can suppress the spread and ensure that health systems and workers are protected. For people also, we ask you to continue to do the basics: physical distancing, hand washing, mask wearing, coughing and sneezing safely away from others, avoiding crowds, and keeping windows and doors open when you can't meet friends and family outside. Do it all. I want to thank the United Kingdom, Egypt, and Indonesia for announcing that they will be joining COVAX. My thanks to other countries who are making commitments ahead of the deadline. On behalf of WHO and our co-conveners, the World Bank, I would like to thank the co-chairs and board members of GPMB for this report and for their recommendations. To hear more on the recommendations, I now hand over to my sister, Dr. Brundtland. You have the floor, Dr. Brundtland.
Thank you. Thank you. Well, I think, okay, so I think it's okay now. Thank you, Tedros. Now, earlier this week, Dr. Tedros joined us for the launch of the GPMB report, A World in Disorder. Many of you will have read it and have questions. We look forward to hearing from you, and we'll try to answer them. When the board meeting and the board was developing its report this summer, we were discussing what the title should be and quickly agreed A World in Disorder. COVID-19 has taken advantage of the disorder around us, benefiting from political tensions, division, and mistrust. It has also created unprecedented chaos, causing catastrophic health, social, economic, and political consequences, especially affecting the vulnerable and disadvantaged. While our assessment of the global COVID-19 response is harsh, we strongly do believe that we can prevent the next pandemic if we learn its lessons and take the actions needed rapidly, boldly, and collectively. I emphasize the word collectively because COVID-19 has shown that we need to find better ways to work together. I served as the Director General of the World Health Organization during the SARS crisis in 2002-03. And I can tell you that we would not have been successful in stopping SARS without global cooperation. Today's pandemic is of an even greater magnitude than SARS. We are living in a radically different geopolitical environment and are facing more complex challenges today. We cannot navigate these challenges if we do not work together. We need to understand this fundamental fact. We are all interconnected through the economy, travel, trade, and information. Many of us have friends and family across the globe. Your security, their security, depends on our collective security. None of us is safe until all of us are safe. A striking finding of our report is the enormous return on investment in pandemic preparedness. Investing in prevention and preparedness will cost billions of dollars. But this pandemic is costing trillions. It would take 500 years to spend what we need to invest in preparedness, compared to what the world is currently losing due to COVID-19. We simply cannot afford to be unprepared again. The GPMB is calling for new ways of financing or preparedness that are sustainable, predictable, on the scale required, and based on the principle that pandemic preparedness is a common good. Thank you, DG.
Thank you very much, Gro. And now I would like to invite my brother, the co-chair, Mr. Asi. You have the floor.
Thank you. Thank you very much, Dr. Tedros, colleagues and friends. Good afternoon. Following up on Gro's introduction, we emphasize in the report that this pandemic has shown us that systems are only as effective as the people who use them. We have seen that responsible leadership is one of the single most important determinants for preparedness and response. Responsible leaders who build trust with their people. They take decisive action based on the best scientific evidence. They discourage the politicization of measures to protect public health. They ensure social protection and promote national unity and global solidarity. They empower their people and strengthen civil society. Their first priority is the health and well-being of their citizens. But citizens play an equally important role. They must be engaged and empowered to hold their government accountable for pandemic preparedness and response. They need to seek out science-based information and fully understand their role in preventing disease, not only in their families, but in society at large. Adopting health-protecting measures may be inconvenient, we agree, but these actions help to protect the most vulnerable. We have to protect each other. I would like to return to the word that Gro highlighted earlier, namely collectively. We offer several concrete recommendations in our report, but I want to highlight the final one, because with this one, we can truly help to work together each other. We have called for a UN summit on global health security. WHO, the United Nations, the international financing institutions, other international organizations, governments, stakeholders, and communities must come together to develop a common framework that brings every aspect of pandemic preparedness together, based on strengthened international health regulations and including mechanisms for sustainable financing, research and development, equitable access to countermeasures, social protection, and mutual accountability, a framework that will help us all work together for the common good. We are fully aware of the disruption and the disorder in the world. This is not an alibi for inaction. We have to take action and take action now. As we say in the report, it is well past time to act. We have identified the actions needed. Now is the time to take those steps boldly, decisively, and collectively. We have the science, we have the resources, we need stronger leadership to take bold action, and collectively. Thank you very much.
Thank you so much, my brother Asi. Now I ask Fadila to take over. Fadila, please.
Thank you, Dr. Tedros. Thank you, Dr. Brundtland and Mr. Asi. We will now open the floor to questions from the press and the public. We will take some from the media and then some from the general public. The first journalist is Michael Bossiov-Rive. He's from CNN Opinion. Michael, can you hear me?
I can hear you loud and clear. Shukran for taking my question. Greetings to all. At the moment on our site, we have an op-ed on how Canada managed to crush the curve, the COVID-19 curve compared to the United States. Of course, one of those ways was early and widespread testing. Now, as you know, testing in the United States has been, to put it mildly, a debacle. My question is the following. Do we have sufficient data to indicate that, like has been done with polio and I believe measles as well, and that is environmental surveillance? Is that an option for detecting COVID-19? Testing of sewage or drainage to look for the virus in many people at once. And some people just quickly have suggested dormitories, care homes, and penitentiaries could be good candidates for this sort of environmental testing. So could sewage drainage provide early warnings for COVID-19? Thank you.
Thank you, Michael. Dr. Ryan?
I can begin. Yes, certainly, and in other diseases, you're right, like polio, environmental surveillance of sewage represents a really useful way of tracking a virus at population level. The presence of the virus, the types of virus, that are circulating, and by itself it's not as useful as when that data from that type of environmental surveillance is linked up with the human surveillance, and then you're able to track both the environmental presence of the virus. All the environmental presence of the virus will tell you is that the virus is present in a given community. If you know the drainage patterns from the various environmental sites, then you'll be able to track the geographic sites, and depending on how sophisticated your sampling strategy is, you can break that down to smaller and smaller geographic areas. So it can serve as an early warning to tell you that the virus is present. It can also serve as an indicator during a response of whether the virus is disappearing, and if you can find the virus in the environmental samples, then it's less likely the virus is present in the population. But what is not known yet is exactly how does environmental presence of the virus correlate with disease in human beings and the intensity of transmission in human beings. But yes, there is no question that environmental surveillance can be a very good supplement to the human surveillance, but we need to emphasize it is not a replacement for surveillance in humans for the syndrome disease of COVID-19 and for the identification of the SARS-CoV-2 virus through PCR and other testing. Maria?
Thanks, Mike. Yes, to supplement what Mike has said, just to mention a couple of the other ways that are really critical for testing. So environmental sampling is one, and Mike has described that fully. But I think what he's also highlighted and what we need to emphasize is the importance of active case finding, where we find people who are actively infected with the SARS-CoV-2 virus, because this is critical to know where the virus is circulating and what public health actions are necessary. It first starts with caring for the individual. Putting the individual in isolation, providing clinical care and the support that they need based on the severity of their infection, and also to carry out contact tracing. So to find the contacts who are in close contact with the infected individual and put those individuals in quarantine and support them through that quarantine period. This will break chains of transmission, and it's really, really critical. We also, many countries are leveraging their influenza surveillance system. You've heard us talk about this many times before. Influenza system that's in place through the Global Influenza Program has been in operation for decades, for more than 70 years. And leveraging that system that exists for COVID, in addition to influenza, has been incredibly important during this pandemic. So looking for cases in the community through the respiratory disease surveillance and the influenza surveillance system is also very important. The third is screening at-risk populations. So in some countries, they are able to screen health workers, for example, people who are more exposed, essential workers. And so that plays a pivotal role to understand if they are indeed infected, and again, take those important public health actions. Environmental sampling has also been mentioned, and Mike has described that. And then lastly, we also look at seroepidemiology. This is not looking at active case finding, but this is evaluating the extent of infection in the population, measuring the antibody levels, looking at when somebody had been infected. So it gives you an evidence that they have been infected sometime in the past. So all of these are different ways and different tools that we can monitor circulation of the SARS-CoV-2 virus. But what is really, really critical, if testing is limited, if workforce is limited, to really focus on your suspect cases, making sure that you do a thorough job of finding active circulation of the virus in individuals so that you can care for them appropriately and take really important public health actions like contact tracing and quarantining of contacts.
Thank you, Dr. Van Kerkhove. The next question is from James Bays from Al Jazeera. James, can you hear me?
I can hear you fine. Can you hear me? I'm speaking to you from New York, where clearly the UN General Assembly is going to take place, but just with the Secretary General and the President of the General Assembly here and everyone else taking part virtually. Dr. Tedros, my question is for you. There's been a lot of criticism of the lack of international cooperation and coordination throughout this pandemic. What for you are the priorities for the General Assembly? What do you want the world leaders to do next week?
Yeah, thank you. Thank you so much indeed. That's a very important question. I think two issues. I will ask two. One is political commitment. That's actually the most important one. And with political commitment, of course, solidarity, global solidarity. One major problem that we see now in the world is lack of global solidarity. The major powers are not working together. So they should, if they are really, if they're going to show real commitment to defeating this pandemic, it's by having a genuine solidarity. That's number one. And second, the resources we need to defeat the virus, we're hoping that we may have a vaccine, is by allocating enough resources. And as you know, the usual financial resources or the support to countries who need financial support is ODA. But that's a very unpredictable, and also the amount of ODA is very small to really cover the needs we have now. As you know, since we started ACT Accelerator and increased the development of the vaccines, therapeutics, and diagnostics, there is already a need for $35 billion, and this cannot be just covered from ODA. And we're asking countries to use other alternative funding mechanisms, innovative funding mechanisms. So two commitments we need from governments or from leaders. One is genuine solidarity, and the second is resources to cover the costs of vaccines, therapeutics, and diagnostics. Of course, we have other requests, but I would really focus on these two, because if we can do these two, the rest could come. But the most important are the two. Thank you.
Thank you, Dr. Tedros. I will hand over now to Mike Ryan. I think he has something to add.
No, just a supplemental point, because you spoke about this need or absence of potentially global leadership collaboration, and I think maybe we've been saying here, and the Director General has said many times, to follow the scientist. In this case, maybe also we should be following follow the science, but we should also be following the scientists, because in as much as there may not have been collaboration or leadership at a political level, we have seen unprecedented cooperation between scientists, doctors, nurses, frontline workers, people in labs who have worked tirelessly together, sharing information openly, thousands and thousands of teleconferences, webinars, sharing knowledge, sharing experience. The people have found a way to cooperate. Leaders need to find the same way.
Thank you, Dr. Ryan. Now over to you, Alex, for the question from the public.
Thank you very much, Fadela, and I thank very much our viewers on Facebook, Twitter, LinkedIn, and YouTube for sending their questions. The first one is, what is the single most important thing we need to do now to prevent another pandemic? And I would invite our guests, Dr. Brundtland and Mr. Assi, to answer this question.
Thank you. Of course, as we have indicated, the preparedness was far from what it should have been when the COVID-19 started, and that was identified some months before in our report from last year. Now, then it took only 2 or 3 months before the COVID started. So clearly, the lack of preparedness and the gaps we have seen and identified, they are still there. And certainly, to prepare for the next pandemic, we have to have a completely different level of investment in preparedness. And it means, it sounds not so much. If we have $4.50 per capita across the world, we can do what is necessary to have a good preparedness. But of course, as I said, preparedness you can measure in billions of dollars, but the cost of a pandemic is in trillions and trillions of dollars. So it really can be done. It's only a question of making these decisions and finding the way forward in collaboration, because we cannot depend on resources coming only from the traditional ODA, Development Assistance System, that is far from too little to face a common good, a public common good, as preparedness is. That's why we are calling for new mechanisms to be established, and for a global health security or a global security summit that can really do what Bretton Woods did after the Second World War, really establish the multilateral institutions that work effectively and have the mechanisms they need.
Mr. Asi, do you hear us? Would you like to add something?
Thank you very much. Do you hear me?
Yes.
Yeah, thank you very much. What we need also, in addition to all of that, and maybe above all, is a leadership. A strong, bold, and decisive leadership that will be driving, people in the path of positive response to the challenges, that we are facing. Our report is entitled "The World in Disorder." That indicates also a kind of a breakdown in leadership today, and that has to be healed. The relationship between people and their leaders must be healed. The trust has to be restored. In order for that, to happen, we need, to have, the leaders delivering on the promises they make and be accountable to the people for their health and their well-being. We have two choices here. The first one is really not a choice, which is the leaders being part of the problem. And the real one choice is the leaders, being part of the solution. And that's, we call for. Unless, we have it, we will not have the solidarity that is needed. We will not have, the spirit of a common good that will bring us all together. So that's why also in the recommendations that we are making, we were hoping that this global summit would be a safe, positive platform for real leadership to be exercised, towards all of us working together collectively in serving people all over the world. Over.
Thank you very much, Dr. Brundtland and Mr. Asi. The next question from our Facebook viewers is, what is the WHO doing to prevent another pandemic? And I would invite our Dr. Jawad Majur to answer to this one, please.
Thank you very much for this very important question. WHO have been working with all countries to support them in making in their preparedness activities, starting by working with them to assess their capacities and help them to plan for better preparedness. But the major challenge that we have been facing is the predictable financing or funding of preparedness. Today, we strongly believe that the global preparedness or the pandemic preparedness is based on three pillars. The first one is country preparedness. No single country will be protected if one single country is not prepared. And this is now very obvious, and the COVID-19 pandemic showed that this very clearly. Second, as the Director General mentioned, global solidarity and collective action is highly important and needed, and we are working with our UN agencies and other partners for the coordination of the preparedness activities. And the third pillar is sustainable funding, as the Dr. Guru Alam and Mr. C said. This funding is required from two sources: domestic funding, where government finance their preparedness and also international funding through predictable and sustainable mechanism. WHO is working with the countries through our regional offices and country offices to implement these activities and to look what are the capacity that's required to make a country prepared, including the implementation of essential public health functions to help countries not only to detect, but to detect and contain any infectious hazard at the local level, and also making the health systems resilient and responsive to any kind of small outbreak, to keep it at this level and not to be transformed to be a big and global threat.
Thank you very much, Dr. Joad. The next question is, what area of this pandemic has been grossly neglected in your opinion? I would invite our guests maybe to answer and the panel in the room as well to ask.
All right, so we come out of that briefing. It's an update, in fact, for COVID-19 by the World Health Organization. Due to time constraints, we'll leave it at that. But you'll certainly get more here on the SABC News channel. Unfortunately, that's all we have time for this Friday afternoon. We thank you so much for taking the time. The full view coming up at the top of the hour from myself and the entire SA Today team. Happy Friday, everybody. Happy weekend. Salam Handle.